Good morning and welcome back to GP Video Podcast by Nadia. Today, the topic that I'm going to talk to you about is prostate cancer. I have seen in 2 days 2 young men being diagnosed with prostate cancer just in succession because I did their PSA, they had some family history and they are diagnosed with prostate cancer. One man was asymptomatic, the other man did have symptoms. So I'm going to talk to you about 5 points about prostate cancer today and the remaining points later. So, number 1, prostate cancer is the most common cancer affecting Australian men after non-melanoma skin cancer. So, the most common cancer affecting Australian men. Around 17,000 people are diagnosed with prostate cancer each year in Australia. For men who have it affects men, of course, and is rare in those under 50 years of age, though in the world, the youngest men to be diagnosed with prostate cancer is 13, but usually it is rare in those under 50 years of age. But as I told you just that the case that I saw yesterday was 47 and the one that I saw today was 60. So for men who have a close relative with prostate cancer, the risk is much higher. And if the relative was diagnosed before the age of 60, the risk is even higher. And now we have to again talk about what does the relative mean, okay? So number 1 point is prostate cancer is the most common cancer affecting Australian men. Rare in those under 50 years of age, but if you have family history or first degree relatives, then the risk is very high. And if they were diagnosed before the age of 60, then the risk is even higher. So number 2 point, as I said earlier as well, the youngest age a patient has been diagnosed with prostate cancer is 13 years old. However, prostate cancer is most common in men over 50 and the risk of developing it increases with age. The average age of diagnosis is 68 years old. So number 1 point was prostate cancer is the most common cancer. Number 2 is prostate cancer is most common in men over 50 and the risk of developing it increases with age. The average age of diagnosis is 68 years old. So point number 3 that I'm going to talk to you about today, and we might just do top 3 points today and not top 5 because this point number 3 is very, very important, is for men. So men, there could be like just the average risk, anybody above 50 years of age with no family history of prostate cancer, they are considered to be as average risk. Then there comes men at moderately raised risk. So moderately raised risk means that, what does moderately raised risk means? One person in the family who has been like brother or father, who has been diagnosed with prostate cancer. So moderately increased risk means one person, one first degree relative, which is brother or father, who has been diagnosed with prostate cancer. GPs should start offer testing every 2 years from age 45 to 69. Now, the interesting part is that there is no formal screening program for prostate cancer as there is for breast cancer, there is for cervical cancer, and for some other cancers, but there is nothing for prostate cancer. So GPs are usually not obliged to do it. But because from a high care perspective, it should be done, and hopefully maybe in the coming years it should be regarded as a normal screening procedure. So the men who have one moderately, the ones who are average ones are the ones who do not have any family history. After age of 50, when they go and see their GPs can offer them to do a prostate specific antigen, and if they are happy, they can do it every 2 to 5 years or whatever is regarded. But with men with moderately increased risk, which means one first degree relative with the cancer, but the GP should offer them testing every 2 years from age 45 to 69. So not 50, from age 45 to 69. And for the men at higher risk who have 2 people in their family who have been diagnosed with it, offer testing every 2 years from age 40 to 69 years. So men, high risk means 2 first degree relatives like brothers, 2 brothers or 1 brother and 1 father should be having their prostate PSA checked every 2 years from age 40 to 69 years, and for men with one first degree relative from age 45 to 69 years. Now, there is another catch here. The catch is, whatever age the first degree relative was diagnosed at, ideally the person should start having PSA 10 years earlier. So let's say if the first degree relative was diagnosed at 60 years, then okay, we are still doing from 45 because that is, but for example, if he was diagnosed at, let's say 55, then 45 is the best. But if it was like 52, then we'll go down from 45 to 42. So there should be 10 years earlier screening. So 3 kind of men. Average risk 50 years and above, GPs can offer. The one at moderately increased risk with one family relative, one first degree relative from 45 to 69 every 2 years. Also, this is also on offering. And number 3 is men at increased risk, like higher risk, which is 2 family relatives, first degree relatives. Then from 40 to 69 every 2 years, again, GPs have to offer it. We'll come back to it because we have discussed top 3 points, so we'll come back to it later.